doing great on this Thursday morning. Hello. Would love to hear where everyone is from if you're watching. It's a rainy day here in Northern California. And I'm excited to have my chai over here, which is almost done. I've been sipping it all morning. So I'm really excited to see you guys today. So grab your cup of chai for the next 20 minutes and let's settle in and talk about our topic today. And I'll also be happy to answer any questions. So great. Okay. So hi, everybody. I am Dr. Prabakar, and welcome to Chai with Cheruba. Cheruba is my first name, and I'm an OBGYN and minimally invasive surgeon based in the San Francisco Bay Area. And so today we're going to talk about what to expect at your GYN visit. I find that there's a lot of misconceptions, a lot of confusion about the GYN visit, the visit to your gynecologist. Some people think you actually don't need to go to your gynecologist. You have your regular primary care doctor, they do all the things. Some others think that, once I'm done having babies, I don't need to go to the gynecologist. I'm all done. Other people tell me, well, I thought I was only supposed to come every 5 years. So there is some misconceptions, lack of clarification and education around GYN exams and actually what happens here. So let me start with that. So the gynecologist is a specialist for women's health, as most of you know. An OBGYN delivers babies plus does gynecologic surgery. Sometimes people split. They either just do OB or just do GYN. Most people do both. And to different capacities. So in my practice right now, I really focus on gynecology. I do a little bit of OB on the outside, but really focus on gynecology and surgery. And the recommendation is for everybody to see a gynecologist every single year. So what actually happens at a GYN's visit? So the first thing is you come in and just like any other doctor, you get your vitals taken, your height, weight, blood pressure. The medical assistant asks you some questions, maybe about your history. And then the GYN comes in, and what I talk about with my patients is a very detailed history, medical problems, surgeries, any family history. I'm particularly looking for family history of breast cancer, ovarian cancer, uterine cancer, so I can provide recommendations about screening or maybe advanced screening or genetic testing based on your family history. And then we're talking about kind of lifestyle. So I spend a lot of time on lifestyle factors in my practice. So I talk a lot about what kinds of foods you're eating, what kinds of exercises you're doing, sleep, because really all of this is the foundation for GYN health. When we talk about issues like bleeding and fibroids and endometriosis and pain, now they can definitely be taken care of by medications and surgery, but lifestyle is still at the foundation of our health. So I spend a lot of time in my office talking about that. So the first part is all, talking, getting history, information about your health, and then answering any questions you may have about your health. And then we move on to the physical exam, which is your breast exam and a pelvic exam. So the breast exam is looking for any lumps, bumps, any irregularities that are happening in the breast. And then the pelvic exam is an exam where we feel your uterus and your ovaries. So we're looking for any fibroids, any masses, any ovarian cysts, anything that doesn't, quite feel right or that we think is off. So that is the pelvic exam. Along with the pelvic exam, we also look at the vulva? Is there dryness? Are there any rashes? Are there any, strange looking lumps or bumps or anything that looks suspicious that needs to be biopsied? So this is just visual information that we're getting. And then often the pelvic exam also includes a speculum exam where we put in a speculum. And if you don't know what that is, I'm going to show you next week. We put in a speculum and we take a look at the cervix. And sometimes we may do a PAP, which is a test that tests for cervical cancer. So we take a little brush and we take some cells right off of the cervix and we send it to the lab. So when it comes to the physical exam, again, breast exam, pelvic exam, that includes a bimanual exam where we're feeling your uterus and your ovaries, and a visual exam where we're looking, and then a speculum exam where we are looking at the cervix and the vaginal canal. So this is done if you have discharge, if you're itchy, if you have any other complaints as well. So that part, so this is what a GYN exam is all about. Now, a few things that, again, I want to emphasize. Number one, a GYN exam should be done every year by preferably a women's health provider. A lot of primary care doctors also perform gynecologic exams, and they're totally capable and qualified to do so. But if you have a more nuanced history, or if you have a family history of things and you want a little bit more detail, a gynecologist is the best person to do these exams because we do thousands of them. And I mean, this is all we do. So we're able to sometimes just give you a little bit more, certainly give you a little bit more information about, anything we find. So please make sure you see a gynecologist. Number two, you need a GYN exam regardless of your age. So there's a big misconception that, yes, once I'm done having kids, I'm done. There are many patients who come in and tell me, oh, the last time I saw a gynecologist was 30 years ago, like after I had my kids. But honestly, most of the problems start after childbirth. We're talking, menopause, urinary issues, prolapse issues, bleeding, fibroids. I mean, there's on and on. There's a lot of things that actually start and get worse after childbirth. So make sure you see a gynecologist regardless of your age. I think my oldest patient is 96. So don't let anyone tell you that you do not need to see a gynecologist. Okay. And the third thing I want to mention, this is a misconception, is that when you have a speculum exam, it does not always mean that you had a pap test. So I'll ask patients often, like, hey, did you have a pap test last year, with your gynecologist? And they'll say, yeah, I definitely did. And then I look at the records and I'm like, no, it shows here that you didn't. So let's do one this year. And they're like, no, I had one. They put that thing inside me, and that thing is a speculum. But that is, again, to look at the cervix, to look at the vaginal canal. It does not mean that a pap test was actually done. So when you're going to a gynecologist, find out if they're actually doing a pap that year, because this guideline is that we don't do a pap every year. This used to be the guideline like over a decade ago, and some people are still stuck in that we do a pap every year, but we actually don't. A pap is done every 3 to 5 years, but we still do a speculum exam. We still do a pelvic exam every single year. So these are the three main things that I want you to remember about your gynecologic exam. And one more tip, when you see your GYN, this is also a time to ask any questions about, your periods, or maybe you're having hot flashes, or I don't know, you're having some pelvic pain. Depending on, what the structure of your GYN's office is, this visit may be 10 minutes, or it could be an hour. So please, you will know based on previous history, or when you make an appointment, just ask like, hey, how long is the visit? Because you want to have all your questions written out, because the time passes by really quickly. And as I said, we have to get all these things done in that amount of time. And so make sure you have your questions written out. And as soon as you see your gynecologist, ask all the questions. So as they're examining you, talking to you, they can put everything together and you can leave with, feeling like you had all your questions answered. Now, in other types of practices like mine, we spend a lot more time. So, you may not, you will not feel that rushed, but regardless of who you're seeing and what type of practice setting you are a part of, I want you to get the most out of your gynecologic visit. So have your questions written out. If you have questions about an ultrasound or maybe an MRI that you had, make sure you have the results so you can make the most of your visit. So you can say, hey, my ultrasound showed this. What do I do? Versus saying, oh, I had an ultrasound. And then I say, okay, well, what did it show? Where is it? And then the patient says, oh, I don't know where it is. Like, then they're like looking up on their phone or they're, and then the time goes by. So I just don't want you guys to not get what you need out of your GYN visit. So, so that's what happens at a gynecologist's office and a GYN visit and a GYN exam. I'd love to answer any questions that you have. So please type them in the chat below. And okay, let's go. Do I need to shave or prep before my GYN visit? Excellent question. So many people apologize, like, oh no, I didn't shave. It doesn't matter. You don't need to do any of those things. We can still do what we need to do. So there's really no prep. I mean, please shower before you come to the GYN. Come to the GYN. That's my only ask. But other than that, yeah, there's no special precautions or anything else that you need to do. Are we allowed to ask for a plastic speculum? The metal ones are so painful. You can ask ahead of time what speculums the office has. So, for example, in our office, we actually use metal speculums. We have different types of, we have different sizes. And the feedback that we get from patients is that the metal ones are actually way more comfortable. They're more smooth. When you open them, they don't click like the plastic ones. The clicking noises definitely alarms patients. I've used both in different settings, and I've had a lot more success with the metal ones, but we do have plastic ones just in case for some patients who may want that. But some offices exclusively have plastic ones. So just ask, when you make your appointment, what kind of speculum they have. Yeah. And also we have different sizes, as I mentioned. For the metal ones, we have very thin ones to very long and large ones. So depending on the patient, we're able to accommodate them. Okay. What test should I ask for if I'm trying to get pregnant? Great question. And this is something that will be determined really based on your history, your OB history, your GYN history, what kinds of medical problems or family conditions that you have. But often we do a basic blood count and your iron levels. We want to make sure that those are good, and a ultrasound to make sure there's no fibroids or ovarian cysts that need to be taken care of before getting pregnant. Now, we may add genetic tests and other panels depending on, again, your family history or your previous history. But there's not a lot that needs to be done in preparation if you are a young, healthy person with an uncomplicated medical history. I do recommend everyone take 3 months of prenatal vitamins before you start to try to get pregnant. Okay. Any other? Maybe you're more gentle. People have told me that I am very gentle. I have very small hands. And so, yes, that is a good thing. Okay. Yay, thank you, Feli. I hope I'm saying your name right. Please ask more questions if you guys have any. Can I ask my GYN about birth control and family planning in the same visit? Absolutely. So this is what a GYN visit is about. But here's a caveat. So I've worked in corporate medicine and in private practice, and they function very differently. So if you're using your insurance, the insurance covers what's covered in a GYN exam is a breast and a pelvic exam. That's it. So if you start asking about menopause or, oh, I'm trying to start a family, what are all the things that I need to do? Or, you know what, I don't like my birth control. Can we discuss other options? Or, if you start to ask other questions, now common sense is that of course, it's all related to GYN health, but do not be surprised if your doctor says, oh, you know what, you need to make another appointment for that. Or I have time to go over all of that, but don't be surprised if you get a separate charge for that. And it's really sad how it's all coming down, but that happens. And I've had patients tell me, like, even when I worked in that corporate structure, like, oh, I got an extra charge because you did a menopause thing with me at the same time. Yes, because an annual exam, again, only covers a breast and a pelvic exam. Now, if you have small questions, I think anybody will answer them without charging you extra or asking you to come back. But just be aware that all of your questions may not be answered at the same time. Again, a lot of these appointments are 10, 15 minutes long. So better just to ask upfront, like, hey, what can I ask in this? Do I need to schedule another appointment? And it's always, like I said, just better to know upfront before, without being surprised at the back end. Now, if your GYN has a different setup, or it's a private practice, it runs very differently. Like my practice runs very differently. Our appointments are about 45 minutes long. So our patients, ask us all our questions. Now, if it's a complicated surgical consult, we don't do that along with an annual. Those are two separate things. But as part of our annual, we talk about bleeding, we talk about, sex, we talk about birth control, we talk about, like I said, lifestyle, exercise, food. So it's very comprehensive. So just know what the setup is before you go there. Okay. That's a good question. Okay. Do they know what causes fibroids? It's $1 million question. We don't know. It's a very multifactorial kind of cause or etiology of what causes fibroids. It's genetics, it's lifestyle, it's the genetics and lifestyle, and also perhaps other mutations that happen in your particular DNA that are compounded by lifestyle, environmental factors, food. There's so many things that cause fibroids or cause them to grow. There is no one specific answer. And there's a lot of research being done on it, not fast enough, but I really hope that in our lifetime, we know what causes fibroids and what we can do about it. Yes, you are welcome. I'm happy to answer more. What are ideal levels of estradiol when one is postmenopausal on HRT? So there is no magic number or ideal level of estradiol. So we actually don't recommend testing hormones once you are on hormone therapy. The recommendation is really to titrate or change hormones up and down based on each individual patient and their symptoms and what's going on with them. So I don't like the idea of testing levels. And, again, there are many different types of doctors out there who will do different things. But as per the North American Menopause Society, the American College of OBGYN, we don't keep testing hormones after menopause. Okay. What happens if my period starts on the day of my appointment? Such a good question. We get this all the time. So if you are having just spotting or very, very light bleeding, no problem. We can still do a speculum exam. We can still do your pap if you're due for one. The one time that I tell patients to reschedule is if they're bleeding really heavily. When we do a pap, it often says, oh, it's unsatisfactory. We got to redo it. Or if you're coming in for a swab, so say you have a vaginal itching, dryness, or discharge, or you're having a specific problem that requires us to look and diagnose and test, then having a lot of blood in there is going to mess that up. So I don't, that's the time when I say, we should really reschedule. But if it's just spotting or very, very light bleeding, it's not a problem. Good question. Any other questions? How do you know when you're perimenopausal? Is there a test? Yes, there is a test. There are a couple of blood tests that we do to check and see whether your blood levels are in the postmenopausal range of things. But again, it really goes based on symptoms. So hot flashes, sweats, vaginal dryness, painful sex, mood changes, poor sleep, just not feeling like yourself, brain fog, memory recall issues, all of those things. Perimenopause um, can be a whole uh, time frame. It can be 5 to 6 years long. It's not one moment in time. So these are conversations to start having with your doctor. As early as 40, late 30s. Some people start asking me, and so we do a lot of education around this, so you know when you may be getting into that phase. Okay. At what age should a woman have her first GYN visit? Excellent question. So I recommend that young women see me before they head off to college. And this is not necessarily to do a pelvic exam and a detailed breast exam and a PAP and all those things, but it's really to educate them on what to expect as time goes on, what's normal, what's not normal, to give them to talk about STDs, HPV. So a lot of counseling and education and guidance as to what is coming down the road and what to expect as they head off to college. Now, the first PAP test should be done at age 21. So certainly you should be having your first GYN exam by 21. And if you have never been sexually active ever, you don't need a PAP test, but still a pelvic exam, just that visual exam, a breast exam, all of those things. So by 21, you should definitely be having your first GYN exam. If you are sexually active before that, so you're 18, 19, I would definitely recommend a GYN exam as well at that time. Even though we don't do the PAP again till 21, we can certainly do the rest of the exam and provide any testing before that. You guys are asking such great questions. Okay. Yes, our show is on YouTube. So we just started last month, and our plan is to continue every Thursday at this time. And my YouTube channel has lots of other, probably over 400 videos by this point on all other topics related to women's health, gynecologic health, fibroids, endometriosis, surgery, all the things, fertility. So you can definitely binge watch those videos there. So yes, I am the Fibroid Doc on YouTube as well and Instagram. So you can catch all of this content there. And next week, I wanted to let you guys know that we are going to be doing Chai with Cheruba from my office. So this is kind of like a follow-up to this session, this show today, this episode. I'm going to be showing you a speculum. What does it look like? And I'm going to be showing you an ultrasound. What can you expect when somebody says, oh, you need a pelvic ultrasound? Like, what does that mean? And then I'm going to also be showing you a colposcope, which is a machine that we use for advanced for advanced testing for those with abnormal PAPs. So it's just to show you like kind of the common things you find in the office and a little bit of a follow-up from this episode. So I'm really excited for that, and make sure you catch us on that and share this with a friend who can also join us and learn more about the GYN exam. Okay, are pelvic exams painful? They're not typically painful. They're uncomfortable, I will say, but they shouldn't be painful. Nobody loves them, but they're pretty quick, about 30 seconds long, but they are uncomfortable. Now, there are some patients who do have pain because of a variety of different issues, physical issues, emotional issues, and we definitely address those. If you do find pelvic exams, speculum exams painful, don't forget to ask about the self-swab. We covered that on a previous episode. But if you don't like to actually get the pap test, but you want cervical cancer screening, the self-swab is great. It's just something it's a swab, literally like a COVID swab that you put in the vagina and twirl around for 20 seconds and you're done. So there are things that we can do to help you still get the screening that you need. Okay. Great. Any other questions? Yes, I was not prepared for the pelvic ultrasound when they found fibroids. Yeah, so a lot of people don't know what a pelvic ultrasound is. So I'm going to show you, what that ultrasound is all about next week. How long does a consultation take? Hope you can share. So in my office, a consult is about 45 minutes long. So again, I run my own practice in the Bay Area, and I prioritize time because these things take time to talk about. But a consultation may only be 15 minutes elsewhere. So please, again, excuse me, know what system you're going into. And even if it's 15 minutes, be prepared to make the most out of that visit. So have your questions written down, have your data written down. When was your last period? Boom, you know it. Don't then start scrolling on your phone and be like, well, let me see. Because time is of the essence. If you have a 15-minute consult, you want to ask those questions, your doctors examine you, listen to your story, come up with a diagnosis, review any imaging, give you the treatment plan. So there's a lot that needs to be done in those 15 minutes. So just ask, when you make an appointment, just ask, how long is this appointment going to be? And is there any information I need to have ahead of time? But I'm telling you right now, as a gynecologist, make sure you have all these things written down and have any imaging ready to go. Okay. All right. What test for urine cancer? There is actually no test for urine cancer. Urine cancer, there's no screening test for it. We really go based on bleeding patterns. So if you sort of have abnormal bleeding or you've got bleeding after you reach menopause, that's not normal. And we should get a biopsy for that. So that's how we would diagnose it. Okay. Well, thank you so much. Yes, our goal in our practice is to educate patients. Education is key. And I hear this all the time from patients that, they've got all these tests. They don't even know what they're for. Can you help me? Can you explain all this stuff to me? And so through these shows and channels, we want to just provide free education for everybody. So even if you're not my patient, I love that you're here. Please share with a friend anywhere in the world who can use this information. And if you're in the Bay Area, come and see us. We'd love to see you as a patient. And, you can get in quickly, sometimes even the same day. So that is how we structure our office. And if you're somewhere else in the world, not in California or not even in the United States, and you want more in-depth information about a specific topic, fibroids, endometriosis, we can book a coaching call with you. This is just purely for information purposes. It's not to be your doctor or prescribe you meds or anything like that, but really just to give you information so you can contact our office about that too. So that is for anybody who is not in California or, in the US for that matter. So, okay. All right, guys, let me just see. I think that is about it. One last question. Is it normal to feel anxious before a GYN visit? Yes, absolutely. I think, going to the dentist and going to the gynecologist, nobody loves. I won't take it personally. Nobody wants to come to the GYN necessarily. Nobody loves the exam. So yes, totally fine. Totally normal to feel anxious. Let your gynecologist know that, hey, I'm feeling a little anxious or I'm nervous. Can you please use maybe a smaller speculum because I'm nervous about that part. So just verbalize what you're feeling, and we try to do our best to take care of you. All right. Okay, guys. Awesome. All right. Thank you, everybody, for joining our episode of Chai with Cheruba. Again, next Thursday, we're going to be in the office, so you definitely don't want to miss that one. I'm going to be in one of my exam rooms. I'm going to show you things and answer questions. Okay. All right. Have a great Thursday. Bye.